Hello everyone, my name is Suspicia. I'm here to present to you guys about my PDSA project in Nursing 451. The first thing is we're talking about the plan, issue identification. The first article that we'll be talking about is predictors of the patient satisfaction as measured by HCAHPS and its a systemic review. There's an increasing concern about improving patient satisfaction. Medicare reimbursements can be affected because of by the patient satisfaction scores. There's like 1.75% of hospital reimbursement could be withheld based on performance key on the key metrics. There's basically 10 questions on the survey. Patient-related predictors were related to patient satisfaction. For example, certain gender and age, such as 85 years old and older, and women had lower patient satisfaction. Minority ratio and ethnic groups, such as being Asian American, Native Americans, consistently reported there's lower patient satisfaction compared to whites. For hospital level, nonprofit status, specialty focus, magnet designation were associated with higher patient satisfaction. Shorter length of stays contribute to patients' satisfaction. The second article is about the experience and patient satisfaction measurement of a complex dynamic. And measurement and understanding the patient, caregiver, and family experience of healthcare. It provides opportunity for reflection and improvement of nursing care and patient outcomes, and measuring patient satisfaction based on many factors that the patient experienced before, during, after an episode of a care, along with the care of environment. CMS quality strategy focus on delivering quality of patient experience. Example, there's six priorities for caring and making care safer, ensuring individuals and families are engaged as partners in the care, promoting effective communication and coordination of care, promoting prevention, work with communities to promote healthy living, and promoting prevention and affordable quality of care. Plan issue identification for HCAHPS is to standardize the collection of data to measure patient perspectives. These factors are organized into 9 topical areas: communication with doctors, communication with nurses, responsiveness of hospital staff, pain management, which is very important, communication about medications, discharge information, cleanliness of the hospital environment, quietness of the hospital environment, and transition of care. Most important is the speedy responsiveness of staff, hospital environment, and pain control and provider communication. And also, there's a nurse burnout and patient satisfaction. There's adequate staffing, good administrative support, and positive relation between physician and nurses reported higher satisfaction with their care. Article number 3, the relationship between HCAHPS, communication, and discharge satisfaction items and hospital readmissions. HCAHPS used as key quality metric to guide quality improvement initiatives. Reducing admission is a focus for hospitals. Readmissions not only burden the healthcare system but also on the individual patients. According to this article, 20% of discharged Medicare beneficiaries are readmitted within 30 days, accounted of billion of dollars. Preventable and readmission services serves as indicator of quality of healthcare. Higher satisfaction with care, lower inpatient mortality, reduce hospital costs, improve patients' well-being upon discharge, reduce admission, and in this article was found that patients with higher severity of illness are more likely to be readmitted. So these patients may be willing to listen and interact with the staff and focus on extra discharge planning. Quality variance. I found an article which is about the patient experience and patient satisfaction measurement of a complex dynamic. Consumers do not have experience evaluating care quality. So there's a couple that I found. Patient satisfaction is subjective and not valid. If fulfilling patients' desires may lead to ineffective care. The second article I found is about demographic factors and hospital size predict patient satisfaction, variance implications for hospital value-based purchasing. So I found that hospital size and non-English speaking strongly predicted unfavorable HCAHPS score. Higher education and white ethnicity strongly predicted favorable HCAHPS scores. The article study illustrates healthcare inequalities in patient satisfactions that are not accounted by the current CMS adjustments. So, education, ethnicity, primary language, and number of hospital beds. So the root cause analysis, I focus on med-surg unit, and there are focus areas in the unit that need to be improved, such as what follows. 2017 goal, improves facilitation that is needed. For communication with nurses, the hospital 2017 goal is 81% for the last 3 quarters in the unit. It's been 74% in February 2017, 74% on March 2017, and 73% in April 2017 for responsiveness of hospital staff. So the goal of 2017 is 69%. So for February 2017, there's 62%, and then we go to 63%, and then 65%. It's getting there. Communication about medication, which is not good because 2017 our goal is 64%, but it looks like we're trending down from 57, 56, and then 54%. So we have to do something about it. Quietness of hospital environment. For 2017 goal is supposed to be 60%, but you could see here we have 46, which is really low, 47, and 40. We're getting there, but really small increments. So I did observation trial done in the unit for 3 days and asked random patients who were alert and oriented in regards of the HCAHPS from above, and its regards from HCAHPS that I talked about. I was able to ask like 21 patients for communication with staff. There's around 17 out of 21 were able to communicate with is effective. Responsiveness is around 14 patients out of 21 patients. Communication about medications, 12 to 21 patients. And quietness, which is also not good, 10 to 21. 10 patients out of 21 patients. So our scope. The province in the unit has been below 2017 goal. Therefore, a planning and solution implementation should be done or encouraged to improve HCAHPS scores. Stakeholders, there are floor RN nurses, primary nurses who ensure that they provide the best quality of care for the patient, including effective communication. Charge nurses, the role of the primary nurses, and to make sure that the patient gets the most effective care during their shifts. And we have nursing aid assistants. They play an important role in increasing responsiveness of the hospital staff during call-outs and effective communication with the registered nurses for any concerns in regards of patient care. Managers. The manager plays an important role in the unit to ensure a high quality of patient care and to strive to improve care, such as mandating policies, system, procedures. Managers make sure that mandatory meetings quarterly were done, and the nurses in the unit attend for updates. And we have supervisors, so supports managers' planning and enforcement of policies and procedures. And these stakeholders play important roles in HCAHPS score. Solution. So improving the patient experience through nursing leading rounds is the article that I found for this. So healthcare leaders indicate that improving the patient experience is one of the highest priorities. Nurse Leaders Round is used as evidence-based practice associated with improved ratings and patients regarding their care experience. Nursing Leader Rounds shown to be effective in increasing patient satisfaction. Good nursing leader involves introducing oneself as a nurse leader and asking about patient experience so far, including what happened during the day and how she is, or how the patient is currently doing. If there are concerns, nurse leader is expected to address concerns, pay attention to multiple priorities, and they need strong senior staff leadership. The next article that I found is about education for medication side effects, a two-part mechanism for improving the patient care. I found that educating hospital patients about medication side effects is nursing responsibility. Without proper education can lead to increased risk of harming patients. For example, being non-compliant with the medication can lead to even death. And the use of medication side effect information sheet. Nurse can highlight and or circle the medication classes applicable to each patient, review the medication with the patient with teach back method. And also the interesting part I found is the use of mugshot concept. When they use in this study, they use it as a pilot study that uses mug labeling, which enable patients to review their new medication information whenever they took fluids, especially with medications were administered. This is pretty cool. And the next article that I found, hourly rounding to improve nursing responsiveness, a systematic review. Hospital stays is stressful for the patients and families. Patients become dependent and socially and emotionally vulnerable. Request assistance for repositioning, eating, and elimination. Hourly rounding has been suggested as a primary mechanism to address basic patient needs. It helps as uncertainty can contribute to patients' increased anxiety and inappropriate coping mechanisms such as getting up to the restroom alone. So addressing this body positioning, pain control, and proximity of personal items decrease can increase patient satisfaction. So we need structured hourly rounding. For example, RN to CNA. So RN will do the rounding for 19 odd numbers, and then CNA will do the rounding for the even numbers. The next article that I found is creating a culture of safety, reducing hospital noise. Noise can cause anxiety and decrease patients' confidence in the clinical competence of the staff. Creating therapeutic environment from all departments can increase patient satisfaction. And the next article is about equipments can cause noisy environment. Therefore, implementing an alarm system configuration policy may be needed. So place signs and slogans regarding quiet sounds for healing, um, provide a hospital quiet program, give earplugs or headphones to the patients, and quiet times and visiting hours should be followed, and establish policies and procedures for managing alarms. So I did a solution implementation, which is on week 4. The day one of solution implementation, I introduced and reinforced the hourly rounding in the registered nurses and nursing assistants. I introduced and reinforced the use of the medication cards from the medication rib with the registered nurses and charge nurses, including writing down a medication on paper that or typewrite it and stick on the patient's mug. Recommended charge nurses to make rounds with patients to remind nurses, including the nursing assistant, about the importance of quiet environment. Make sure there are posted signs saying about silence. Remind visitors about visiting hours. Provide earplugs and headphones to the patients. Then on day 2 of the solution implementation, I reinforced the solution implementation during huddle and observed some nurses and the nursing assistants. And I asked random alert patients about the HCAHPS I want to focus on, which is the responsiveness of the staff members, communication and quietness, and the environment. And then on day 3, I still did the same solution implementation. Then week 5 for the 3 days on the floor, it's the same thing that I did last time, which reinforced the solution implementation during huddle, continued observation with nurses and nursing assistants, and continue to remind charge nurse about the importance of nursing leader rounding, and ask random alert patients and responsiveness, because later on I added them up, and then I put them as my analysis. So I added in the interventions for communication with nurses. I recommended encourage eye contact and introduce oneself and explain the purpose to the patient and family members every time they enter the patient's room. For responsiveness of hospital staff, maintain positive language and remember that no bad zone. So when you see that call light, can't just say, oh, call the nurse. You just go in there, take a pic, turn off that call light and say what do they need. For medication communication, keep continuing to use med cards. Ask open-ended questions to verify the patient understands, such as, what can you tell me about the medication possible side effects? For quietness, when entering a patient's room at night, keep lights and voices low. Make sure that alarms protocol are followed. So my analysis on week 6, I did 3-day data collection done from week 5 for the solution implementation. We set goals, for example, for responsiveness of hospital staff. For random patients that were interviewed, there were at least more than 70% will be able to say yes, that the staff were able to respond to their needs appropriately. So out of 33 patients, there's like 26 out of 33 said yes. So that's around 78%, which is met. Communication about medication. For the random patients that were interviewed, there will be at least more than 65% will be able to say yes, that staff were able to communicate their medication side effects and action. Out of 33 patients, 20 out of 33 said yes. I still have a problem with this one, so not met yet. For quietness of hospital environment, for the random patients that we interviewed, there will be at least more than 60% will be able to say that there was a sense of quietness in the hospital, who stayed longer more than one night in the unit. Out of 33 patients, 22 out of 33 patients said yes, which is met, and we'll continue improving it. On week 7, so our next steps, we continue the nurses and staff members about interventions that may help increase the HCAHPS, continue the hourly rounding by nursing staff members, such as alternating with nursing assistants and RNs. And also we have this paper that we put on the patient's chart, which will not belong to the patient's chart, but we just sign it to make sure so the manager or supervisor can look into it and say, oh, these nurses did the rounding. So we want to make sure we do this to increase our patient satisfaction. Continue the nursing leader rounding by asking the patient and family members about any concerns and plan of care, and continue the use of MedCard. The patient may need to continue to see if the use of mugshot concept will be helpful in the future to increase the patient's understanding about certain medications. Continue to provide quiet environments for the patients, such as reminding family members about visiting hours, provide earplugs or headphones, follow equipment alarm protocols. I recommend the charge nurse, including the manager, to do random questioning of their patient in regards about hospital responsiveness, communication, medication, quietness of hospital environment, to make sure that nurses are doing their responsibilities. If the goals are still not met for the communication of medication, I recommended the use of the mug shot concept and continual reminder of the cardiac use with the patient, and also the continual observation of their staff to make sure that we maintain this to reach our goals. And these are my references. Thank you.